Hi, I'm Dr. Martin Nielsen out of Aalborg University Hospital in Europe, Denmark, and I'm speaking to you about my JBJS article, An Ultra-Short Stemless Femoral Hip Prosthesis. Whenever I do a hip arthroplasty in a patient between 40 to 60 years old, one of my main concerns is always how much proximal bone stock will be available if I need to do a revision in 20 to 30 years' time. Over the last couple of decades, several manufacturers and surgeons have tried to develop an ultra-short femoral prosthesis to retain as much proximal bone stock for the eventual revision. Unfortunately, very few long-term studies have been published. We speculate that this might be to poor outcomes, but we do not know. That is why we're happy now to publish a 10-year follow-up study on the ultra-short stem femoris. Our study reveals that the stem leaves very low stress shielding in the proximal femur. The clinical outcomes are excellent, but we did find an unexpected varus tilt of the stem. Unfortunately, the prosthesis is no longer in production, but this study suggests that at least some of these ultra-short femoral hip prostheses are a durable and viable option, at least for the younger patients where we have to expect to do a revision in 20 to 30 years' time. Of course, longer follow-up studies are needed of this prosthesis to see if the stem migrates further, and we're planning to do that. Thank you.